Hi, this is Dr. Bob Dannenhoffer, the Public Health Office for Douglas County, and I'm here today with Melinda Sprague, the Public Health Improvement Manager from the Cow Creek Band of the Umpqua Tribe of Indians, and they've been incredible partners during this entire COVID pandemic, so I'll get a chance to talk a little bit more with Melinda as we go on. So in the world, COVID is quieting. In almost all of the continents of the world, we're seeing a decrease in number of cases. We're still seeing places in Asia and in Eastern Europe, especially, that are having high numbers of cases. But for the most part, the world is pretty quiet here in the first part of October. In the US, cases are clearly coming down, hospitalizations are coming down, and deaths, I believe, are also starting to come down. Much of the East Coast and much of California is pretty quiet, but we're still seeing a lot of disease in Montana, Wyoming, Idaho, and Alaska. And those are areas that have relatively small dispersed populations, and they're struggling more than a bit with their hospital capacity during this time. In Douglas County, our number of cases is coming down. We were over 150 cases per day. We're down now to the 30s and 40s, which is certainly a good sign. Although we still have a lot of people in the hospital, over 40 people in the hospital, and we're still seeing a large number of deaths. When we look at our cases, almost all are unvaccinated. So when I looked yesterday in the hospital, of the 46 people in the hospital, 3 were vaccinated and 43 were not. And since more than half of our adults are vaccinated, this is truly a stunning protection that you get from the vaccine. So the vaccines still seem to be working well, and especially good at preventing hospitalizations. The saddest part is deaths, and we're reporting more deaths almost every day. We've had over 130 deaths since the beginning of August, and many of these deaths are in older people or people with underlying conditions. But unfortunately, some of the deaths are among young and otherwise healthy people who have many years of life to live and are dying of COVID. The good news is the vaccines are still widely available. They're free, they're safe and effective. There are some side effects associated with vaccines. We've certainly have seen some allergic reactions. It has been reported in the country that there are some cases of myocarditis, although we've not seen any that we know of in Douglas County. And so the vaccines are really safe and effective and far safer than getting the disease itself. So let's talk with Melinda today about the help that we've been getting from Cow Creek. So Melinda, welcome.
Thank you, Dr. Dannenhoffer. Thank you for having me.
Well, this has been a tremendous time of cooperation between the Cow Creek tribe and Douglas County. So tell us all the stuff you're doing, and it's a long list.
It is a little bit of a list, and I just want to start off by saying we definitely appreciate our partners at the county, Board of Commissioners, Douglas Public Health Network. I know you've taken a few of my phone calls over the last few weeks. Yeah. We really appreciate everybody's. I think we've all been able to come together really well as a community and help each other out through the surge and kind of provide a really widespread network of partnership. To speak specifically on some of the things that we've kind of done during this surge time, back in August, we started to kind of see that surge kind of at the beginning of August. And anticipating that surge, we had such an increased need for testing that we went ahead and said, well, let's go from a clinic-based model to a public health-based model. And what that meant was we went from doing a clinical model where we were testing just patients on a clinical basis who are registering with our clinics to a community-based public health testing model where we were able to test about 4 to 5 times the amount of people at each location. And we did that because with the surge, there was such a high need for testing in the county at the time that we just felt that we had to kind of come together and figure out a way to get people tested and get some of that infection control. So back on August 14th was the first weekend that we did community testing. And the first weekend that we did it, we put the flyer out very late. It went out I think the day before testing, and we just said, well, we'll just do it this first weekend and kind of see how it goes. And we anticipated that we would maybe test 30 folks. And we had a line down Stevens when we got there to start testing in the morning. And we quickly realized, I think we tested almost 150 people that first day. And we anticipated testing 30 to 40. And so we knew that as we continue to see the numbers grow, that it was just going to be such an increased need that we would have to continue at that capacity until things started to slow down a little bit. In the month of August, we tested over 2,800 people in Douglas County, and we were seeing about a 24% positivity rate at that time. It was pretty high, I would say about 1 in 4 people, and there was a week stretch there where we had so many people that were testing positive that I just thought, oh man, if it continues at this rate, I don't know what it's going to look like 2-3 weeks from now. As we kind of rolled into September, more of the word kind of got out that we're continuing these ongoing efforts with the testing. Kind of folks getting back to school and getting back into their routines, there was that increased need for testing as well. And so we tested about 3,500 people in the month of September, but we did see about a 15% positivity rate. So it dropped about 10-11% during that time. And we've, like you said, we've continued to see a slow on the positivity rate on our end as well. I think as far as October goes, we've been sitting right around 11%. So we are seeing that decrease on our end as well. This Friday, the 8th, is the last day that we're going to be doing that community testing model. We are going back to a clinic-based model just because the need is less and the surge is dying down. And we're going to kind of shut down that community testing model. FEMA is going to be coming in and kind of taking on that role and things like that. So we are kind of transitioning away from that. And then we're going to continue to assess need throughout the months of October, November, December on a weekly basis and work with our community partners to see kind of what the need is and adjust as needed as we kind of go along. As far as our vaccines go, we did vaccinate 251 people in August, and we vaccinated 280 people in September. We have seen a lot more folks coming in for vaccine kind of recently, and I think part of that is some of the ongoing mandates, and as well as just folks making some educated decisions and what's best for them. And we have been offering those vaccines 7 days a week as well. Right now we're offering them 5 days a week, and today is our first day of offering Pfizer boosters. So all of the 65 and older individuals that were vaccinated with their second dose of Pfizer by Cow Creek Public Health have been contacted and offered a booster. And today is our first day of administering those Pfizer booster doses. Speaking in that regard as well, we're still waiting for some other information to come through on the other COVID-19 vaccines. When that does happen, we will call those people that we vaccinated and ask them if they are eligible. We do get a lot of phone calls about boosters and folks wanting some information. We will call those folks individually once they become eligible for those booster doses, should they become eligible. As far as our PPE goes, we have been checking out PPE to a lot of community partners, just trying to make sure that everybody is supplied with the proper equipment that they need, N95 masks, gowns, gloves. We've checked out to a handful of agencies in Douglas County and a couple of agencies in Jackson County and a couple of agencies in Coos County as well. So we've been able to kind of help support those efforts and provide some supplies for folks. If there are agencies that have needs, please feel free to have them reach out to me. And if we can meet their need, we definitely will. As far as total vaccines given, to date, we have fully vaccinated 3,329 people. And we have administered a total of 6,299 doses of vaccination. So we're really...
That is incredible. You've helped us in so many other ways. You've done the case investigation and contact tracing for us, which has been great. So the cooperation really has been so remarkable.
Thanks, Dr. Dannenhoffer. Yes, we do. We do contact trace for the American Indian Alaskan Native folks in Douglas County. And then we also contact trace for employees of the tribe and tribal entities. And so we do help in that regard as well. And we love working with Becky and your team at Douglas Public Health. And they've been great on kind of alerting us so that we can kind of help those specific populations of people navigate the contact tracing process and also the aftercare process when they do become COVID-19 positive.
Yeah, it's been great. So two things you mentioned. One is about boosters. And so we do know that boosters are approved for people who got Moderna or Pfizer and have a condition that makes their immune system work less well. Say they have cancer or end-stage HIV, or they're on immune modulating drugs, they're already approved to get boosters. For people who got Pfizer, they're recommending boosters for people 65 and above, or people 50 and above who got their second dose 6 months or more ago. For people who are 18 to 49 who got their second dose 6 or more months ago, it is allowed but not specifically recommended. We're expecting next week to hear about the Moderna and the J&J booster shots. And when we hear about that, we'll certainly let everybody know. And then you mentioned that you're going to be testing until the 8th, but then starting on the 10th, there's going to be an effort between FEMA, Oregon Health Authority, Douglas County, and lots of partners in the community to have a mobile medical clinic. It's going to be in the parking lot across Fowler Street from the library. And they're going to be there every day except Mondays from 11 a.m. to 6 p.m. They're going to be doing first, second, and booster shots for the vaccines. They're going to be doing COVID testing, and they're also going to be doing free flu shots. So this is a chance, if you need a COVID vaccine, to get it. If you need a flu vaccine, go get it. If you want to get tested, go get tested. And they're going to basically take up where you guys left off between October 10th and October 22nd. So there's a lot of good news in town with the decreasing number of cases, and I think we're having an increased ability to get vaccinated and to get tested for people who want. But in this really tough time in August and September, Cow Creek was an absolute godsend to help us with testing and vaccination. So I cannot thank you enough.
Thank you. Yes, we were happy to do it, and we're happy to help folks in any way that we can, whether it's trying to meet their needs or PPE or testing. The community's been really great, and so many people have sent emails thanking us or commented on our contact us on the website. A lot of other community partners have, said thank you so much. And I'm really thankful to work for the Cow Creek Tribe because they are very giving individuals. And so we're just happy to be good partners and help to meet the need during this kind of surge. And also really happy to see that trend slowing down in the community as well.
Yes, so that is great news. Well, we hope to work together in the future on lots of other projects, especially diabetes prevention, work to see if we can decrease our rate of obesity. Because what we have seen during this pandemic is that people who are overweight and obese really had a tough time when they got COVID. So this really sets us forward for projects that we hope to do for many years in the future.
Yes, definitely. I am always dreaming of the post-COVID projects and the great programs that we have all focused a lot of time on COVID-19 response. And so I think as we continue to see those trends slow, it'll be exciting to implement some new programs and work together in different ways.
Well, thank you again. Thank you for joining us, and hopefully we'll get a chance to do this again soon.
Yes, thank you for having me, Dr. Dannenhoffer.
All right, take care.
Thanks, you too.